The chair today is Councillor Janice Charles, who's currently on screen. May I remind everyone present that the meeting is being live streamed as well as recorded via the internet, and this recording archived for future viewing. Could all participants please mute themselves when not speaking in order to avoid any background noise or feedback when other participants are speaking. If a participant wishes to speak, can they please put their hand up if they cannot be seen on screen, or use the raise hand function via Microsoft Teams. If you do use the raise hand function and are not subsequently invited to speak by the chair, then please could you turn your camera on to indicate to Councillor Charles or place a message in the chat function. When invited to address by the chair, please could all participants ensure that their microphone and camera is on to ensure that they can be seen and heard when actively participating. If this is not possible for any reason, please could you bring this to the attention of your chair, Councillor Charles, who's on screen for you now, or myself as the Democratic Services Officer. Please ensure that all debate is raised verbally and not via the chat function for the sake of the recording. The chat function may be used to highlight any technical issues and or to grab the attention of myself or Councillor Charles. If any participant has difficulty hearing or being heard when they are addressing the committee, then please could they let myself or Councillor Charles know. Thank you, Chair. That concludes the housekeeping.
Thank you, Becky, and thank everybody for joining us this evening. It's still 28 degrees according to my thermometer in the garden, so I do appreciate your attendance. And the first agenda item is agenda item 1, which is apologies for absence. Do we have any apologies?
No, by myself, Chair.
Okay, anybody else got any? I can't see anybody. No. Thank you. Takes us on to agenda item 2, which is the minutes of the meeting held on the 16th of May 2023. And I believe that Councillor Marianne Cope, you have some errors that you would like to bring up with the minutes of the last meeting to do with lice.
Yes, thank you, Chair. There's a couple of things. They're not as errors as such, but to make them more accurate, I'm suggesting, if I may, that minute number 24, the Clyce presentation from Wales, bullet point 5, page 4, replace the word replaced with were in addition to, because this more accurately reflects that the University Health Board complaints and concerns process is actually still in operation. And the second point is minute number 25, the performance evaluation inspection report, bullet point 8, page 6. I'd like to suggest, if I may, to replace the second use of the word comments with reactions to more accurately differentiate between the negative comments that were received and the positive reactions received on the social media channel, because they are two different things, really, comments and reactions.
Thank you, Marianne.
Thank you, Chair.
I don't have a problem with that. Are you okay to amend the minutes with that, Amy?
Yes, I can make those amendments for accuracy. Obviously, I can take the, may I take the previous minutes moved by Councillor Cowpe, subject to those amendments and seconded by yourself?
Yes, certainly, thank you.
And I'll second that. Thank you. Anybody else? No. Right. Moving on to agenda item 3, which is to receive declarations of interest and the nature of such interests, including whipping declarations under the Council's Code of Conduct. Does anybody have any declarations to make? I can't see anybody's hand up, so I'll take that as a no. Which takes us on to agenda item 4, which is the Cardiff and Vale Glamorgan Dementia Strategy Update. And I believe Fiona Cahorn is going to give a 10-minute presentation, and then I'm going to allow 20 minutes for questions. So if you'd like to go ahead, thank you very much for coming.
Thank you, Councillor Charles, and it's a real pleasure to be here, and I'm here with some other colleagues as well. I'm here with Chris Ball, who's our Ageing Well Programme Manager under the Regional Partnership Board, and Dan Crossland, who's our Director of Operations, and Dan will introduce two other colleagues, Joe and another colleague, I think, who's attending as well, who's part of his team. So we're going to highlight the dementia strategy and programme, and I think we last updated to you in July 2019, so it's a real pleasure to be back again. And we'll just remind you a little bit of what our strategy is about. And that was done it was a partnership strategy. It sits under the Regional Partnership Board. There's been really good progress. There's also been additional things expected from Welsh Government, which Chris will highlight to you. So a little bit of the wider context also there sits, just as a reminder, really update on the progress so far, including areas of focus and new practice, and just a little bit about next steps. And we've taken this opportunity, and Dan and team are here really because often questions we get, there's an interrelationship with mental health services for older people, which are a separate set of services, but of course they overlap and link in very clearly with the dementia strategy. And we thought it'd be really helpful for Dan and his colleagues just to highlight what are some of the developments in mental health services for older people, so that you've got that opportunity as well to question us on that. So I will just kick off and then I'll hand to Chris. So just a reminder of our strategy. We agreed and published it in 2018. It was a 10-year overarching strategy with clear actions and timescales within it. And our vision was and is, it's still pertinent today, is that by 2028, the population of Cardiff and Vale of Glamorgan will be dementia aware and will reduce their risk of dementia. Now that's it's a vision. Obviously all the work that we have to collectively do to try and realise that. And that people with dementia will have equitable and timely access to a diagnosis. They will have person-centred care delivered locally with kindness. And the value of kindness, I think, was loud and clear in all of the participative work we did in the lead up to publishing this strategy. And that carers will feel supported and empowered. And the strategic objectives link across to that vision, so that dementia is everyone's business. It touches us all in the room. It touches us, our families, however we've had experience or connection. It's an important arena of work for our population, to all of us. The risk of dementia will be reduced and there will be timely diagnosis. Access to services will be equitable. Services will be fully coordinated. Services will be delivered with kindness and compassion. Support will be centred on primary care. Carers will be cared for, and crises will be avoided. It doesn't mean to say that we're perfect and we've fully achieved that, but that is what we're striving towards. So I'm now going to hand to Chris, who will take you through just some of the background context and additional change, and then to move on to what we've delivered. So over to you, Chris.
Thank you, Fiona, and thank you, Chair. And it is great to be here discussing the strategy and our regional programme. So first of all, as Fiona pointed out, I wanted to sort of highlight the context in which this work sits, both nationally and locally. So I suppose, like many initiatives, dementia is quite crowded in this area, but a great deal of important work which all has to be aligned into how we develop things locally. There's the key national strategies that you'll see there, the Dementia Action Plan and the companion document, the Dementia Care Pathway of Standards and the Dementia Friendly Hospital Charter. But along with that, we've got our local strategies, plans, reports, as well as some of the wider national work. And all of this has to be synthesised up into our programme and what we're delivering for the population of Cardiff and Vale around dementia. So that's all I wanted to say on that, but you'll see there's a lot of work going on. So in terms of our local programme, and in developing this over the last year, we've tried to consider the entire journey, I suppose, from a citizen in the community who may not have any knowledge really around dementia, but there are still things they can do to reduce their risk factors and also be part of a supportive community, through to the support someone receives if they require a hospital stay, and including their carer as part of that journey. So for each of these elements, I've outlined some of the activity in each area which we feel is making a difference, and some of the data around that from the last year. And some of these areas are still developing, but a lot of these areas are now established and are embedding pieces of work which have been implemented since the last update in 2019. So prevention is really around, do people understand their risk factors? And we've started developing an awareness campaign based on the sort of known modifiable risk factors, those things you can do to reduce your chances of developing dementia by up to 30% actually, and that work is very much in line with the work in the public service boards and and public health around Move More, Eat Well and Help Me Quit as well. The other part there is around dementia-friendly communities, and this is, asking, do people understand dementia? Can we make communities a supportive place to live? So the main part of this, we've been working with businesses on developing them to become dementia friendly and sign up to being dementia friendly. So high street businesses sort of know and understand their role in supporting dementia, as well as looking at third sector support and the community assets such as dementia cafes, which already support in this area. Community care and support, which is the next piece there, is teams who can provide that specialist dementia support when it's needed. Community connection, nursing, therapy, social work teams, working with care homes, and memory link workers, those sort of named individuals for people who can offer that support and signposting as needed. We've also got some work around assessment and diagnosis, so trying to give people the best possible experience, i.e. sort of timely, closer to home where possible, and with the right level of follow-up support. And we've done that through having GP-led clinics at GP practices much closer to people's homes. And then, of course, if people require a hospital stay, there's work going on to ensure that is a positive experience both for the person with dementia and their carer. And the final bit that I wanted to point out, and it's sort of a thread that runs through it all, is around the training and development work. So we've got a separate team who coordinate this, and because it's about empowering people to have the skills and knowledge that they need to support people as much as possible, and also they lead on a lot of our engagement work there as well. So that's what we've been doing over the last year. I suppose next steps now, and I realised that sort of picture that down the bottom is quite small, but that's just to give some assurance that we've got a governance structure around this work which sits underneath the regional partnership board. We've got leads and projects taking forward this work that I've just discussed, and there's also a Dementia Champions Network, which sits very much alongside our programme board, but has people affected by dementia on it, so that we can do some sense checking and some meaningful engagement on our work. And then the next few parts to this slide are developed from our engagement events that have been done as part of the area plan for the regional partnership board, which I know you'll hear about later. But they reflect the areas that people felt were most important to either continue or develop, which align to the delivery of the strategy very much. And I would say at this point, colleagues and citizens from the Vale were a valued part in shaping this work, and so thanks to those involved. So we will continue to develop those areas that discussed, and that will be built on or extended through focus on the following areas. So accommodation solutions to support people to live independently, tech-enabled care, which continues to develop at pace, and an understanding of how that can support across the whole journey, as we discussed earlier. Ensure people with learning disabilities have actual access to service and information, support advanced care planning and community to minimise the risk of crisis and enable choice, continue to build on the hospital focus work, and also really consider the needs of someone's carer, including flexible respite options to keep the carer well in the community as well. So we hope that by doing that, and this is my last slide before I just move on to Dan very briefly, is that this will help to deliver our vision over the next 5 years. And in terms of what that will actually mean and the difference people will see, we've tried to outline here. So what's the actual difference that people will see? And you know, it's really important that people understand and reduce their risk factors, that communities are really empowered, that there is a timely and smooth diagnosis process, individual plans for people which avoid crises as much as possible and supports through any hospital stay, support, as I mentioned earlier, in developing advanced care plans, access to accommodation and technology which enables independence, and of course unpaid carers feeling supported. And the very last part of that is, that's all very good. How are we going to show and measure that we're making a difference? And these are some of the measures that we'll be using to define and understand how well we're doing. And I very much hope that when we bring the next update, we'll be able to show some of the data against this about what is the difference that we are making, because there's a lot of work going on to build those baselines and look at the direction of travel and ensure we're moving in the right direction for the people in Cardiff and Vale. So I'll finally hand over to Dan Crossland to run through a bit more work on the mental health services for older people.
Thanks very much, Chris. Thanks, Chair, and thanks, Fiona. Just wanted to introduce myself. I'm Dan Crossland, the Director of Operations for the Mental Health Clinical Board. I brought 2 colleagues with me to give a bit of an overview and expertise around the operational and the clinical. And that's Joe Wilson, who is our Directorate Manager for Mental Health Services for Older People, and Marianne Seabright, who is our Lead Nurse for Mental Health Services for Older People. They're both here with us today. So just to give a quick overview of our services, really, we wanted to draw people's attention that often people think that our services are mainly focused around hospital, but we've got quite a broad range of services that span across. And we wanted to just flag some of the innovation and the development of new roles that really are critical in delivering the principles that Chris has outlined in terms of the programme. So we are 6 wards with 84 beds. We have a young onset dementia respite bed, 3 integrated community teams, the REACT team, which is about supporting people in moments of crisis and challenge, care homes liaison, community liaison, psychology counselling and outpatients. So quite a range of services outside of the hospital. We also have a couple of teams that work with us, the young onset dementia team and the dementia learning and development team. And which, in terms of the innovation, we've really focused around leadership in this area with specialist nurses working around particular presentations and where we can develop staff to build their support, their expertise and the leadership in those fields. So the 4 articulated there: a clinical nurse specialist for dementia, for family work, for psychosis and for functional mental health. And what we mean by that is those mental health experiences that are related to dementia. And then beyond that, we have several other innovations there with new roles, and these include a specialist practitioner, inpatient psychological services, a dementia care advisor for inpatients, a bereavement support worker, a natural waking worker, and a carer peer support worker, which is an individual with lived experience of caring for a relative with usually a dementia. The natural waking worker is quite an interesting innovation, and I'll leave my team to come in just to explain a little bit around that, because it's quite nice really in how we're making those ward environments more dementia friendly. So Joe and Marianne, I don't know if you wanted to come in on that one specifically.
Yeah, so the natural wake-in worker came to us through the dietetics and the physiotherapy team, who identified that patients, as with all of us, don't want to wake up at a certain time every day, and that's not conducive to good inpatient care. So we piloted for a year a healthcare support worker to just work on the natural waking basis. So working with people to wake up naturally, which we found can aid restful sleep. It can improve appetite and reduce expressions of need. So sometimes we call those challenging behaviours. And what they've done is they've worked with people to help support during breakfast times and meal times, help towards the end of the day on the sundowning period when people are maybe needing different diets to aid their sleep. And we found really positive things. We've only been able to pilot this on one ward so far, which is a male dementia ward. So it's worked so well that it's something that we'd really like to roll out. It's also a great example of working as a multidisciplinary team. So you work in a therapy team, working within a ward environment as well.
Thanks, Joe. And just in relation to the bereavement support worker, this was a pilot that we delivered, and we've begun to evaluate. Joe, I don't know if you wanted to talk a little bit about that one.
Yeah, actually, the bereavement support worker post was with us for 18 months. And what we realised was during COVID, a lot of our patients experienced grief and loss. But those living with a dementia might not have maybe understood the process or been able to support themselves through a process. And then quite often their families and loved ones had to also deal with that same grief and loss, but also trying to support their loved one as well through the maybe repeated kind of experiences of this grief. So the bereavement support worker met with many patients and carers and families just to listen, really. The first part of the project was listening, hearing what people needed, linking in with charities such as Cruise and other local organisations, but also developing relationships with people like the Welsh National Opera and the Forget Me Not Chorus, walking groups within Roath Park and other parks, and dementia cafes. And although the post now has stepped back, what we've got from it is some very rich information that is available for all of our patients, families and carers. And the person who was covering it is now one of our clinical nurse specialists. So we're very lucky to be able to continue with that work.
Thanks, Joe. And just the final flag really is for the integrated working that we do in our community teams. So we're working very closely, not just with the regional partnership board in terms of developing the strategy and ensuring that our vision is aligned to the programme, but also working with the local authority very closely in those areas, both in the Vale of Glamorgan and in Cardiff, across those integrated teams. Thanks very much.
Thank you, Councillor Charles. So that's a whistle-stop tour, but you'll see this is a partnership endeavour, and Dan's just ended on that with regard to mental health services for older people, but also in the dementia strategy that Chris highlighted. So just to thank council colleagues for all their work and involvement in this, both of these agendas. Thank you.
Thank you, Fiona, and thank you very much, team, for coming today. I think most of us at one point have been touched with knowing somebody with dementia, or we will eventually, no doubt about it. So I'm glad that you have this work programme ahead. I have several questions, but first of all, I'd like to open it up to the floor. Yep, we have somebody there. Let me see who it is. Councillor Christine Cave.
Thank you, Chair. I'm just hoping my laptop will survive the heat here in the conservatory long enough to hear everybody's responses. It was a real whistle-stop tour, and I just wondered whether it would be useful to gain a sort of a deeper understanding of, if you could talk me through, because information often is key, isn't it? even from the beginning, helping people to be more dementia aware themselves to stop the impact of dementia long term down the road. So information is key. And I just wondered if someone in the team could talk me through where they think information can be accessed at different points in the journey. So I wonder if you could start with something like, I have a relative, I think they have dementia. Where would I go? Because I wouldn't know where to go, but I'm sure there are dedicated markers here. There is a care pathway, an information pathway, but I just wonder what that pathway looks like and how well we're doing at advertising that pathway.
It's probably one for Chris. The first port of call is always a GP, a primary care, but I think, but Chris, do you want to maybe just very briefly run through the pathway and how people would know about it?
Yeah, certainly. And actually, this is a piece of work that we're doing and we're developing at the moment. And this forms under the sort of dementia-friendly communities. Where's the information? Where do people access it? It's not necessarily that that they may have a diagnosis. It's actually, there's a whole host of information out there that says. That tells you lots of different things. So there are, I suppose, a communications plan developing around what are the materials that we have, who is the best to signpost to, and where do people go. Part of the central piece of that are the Dementia Friendly Vale and Dementia Friendly Cardiff websites, but understanding that that's not the best place for everyone, and not everyone's going to see that, and you're only going to see that if you're signposted to it in the first place. So that's why we're developing the communications plan around that, and then it's about educating as many people as possible as to where can they find the information, where can they go for the information, and that's where the dementia friendly businesses and also for people to understand their risk factors and a little bit about dementia so that they know really where to go to. But we're trying to create those centralized resources that's sort of a one-stop shop that's fairly easy to navigate, and also educate those key people that might be out in the community that come into contact with people with dementia. I suppose that for once you have a diagnosis, you will have connection with a memory link worker who'll be able to signpost you, and then a whole host of services that will be hopefully wrapping around to support you. But certainly this is a developing piece of work. I hope that helps.
Yes, thank you for that. I do think we could run the risk here of being over-reliant on businesses. When we talk about dementia-friendly communities, I do think business has a role to play, and you've obviously reached out, in major towns, for example. But I represent a rural ward, a very rural ward actually, and sometimes there's not even a pub, believe it or not. There's only maybe a bus stop and a post box. So I wonder how you, because we talk about equitable services for everyone, where we can all access in the same way. So I just wonder, for me, it feels like business is one element of that, but it should be much wider. And I wonder what the thinking around that is.
Absolutely, and that's what we're developing, and it's not solely reliant on businesses, but certainly all those places where people might go, even bus stops, as you say, councillor. So what's the information? Where is it? GPs, hubs, libraries, cafes, those groups that people might go to, third sector organisations. It's trying to get it the reach to the right people, and of course finding those ways that word of mouth and people can interact and help each other within the community as well, and supporting communities as a whole. So definitely not just focusing on business, but certainly looking at the wider impact there. Is that okay?
I just wonder if you could just expand on, are there any specific things that you know about that are happening in rural areas?
I can't give any specific examples at the moment. I can look into it. I can go to the teams that are doing that work and find out a bit more about that for you. Certainly that's led by people in Vale of Glamorgan Council who are supporting that work. So I'm sure we can find out what's happening. I'd be happy to come back to you, Councillor, on that.
That would be lovely. Thank you.
Councillor Cave. Yeah, I think education of the carers is a huge factor. Having been a carer of somebody with dementia myself, and I had to find out what to expect and how to deal with it. And I think people don't really know. They think they're being kind, they think they're being caring, and they're doing all the wrong things. So I think education is a big factor. Would it be possible for you to send us the PowerPoint slides, please? Councillor Neil Thomas.
Yeah, thank you, Chair. Thank you for the presentation. It was interesting. You talk about, partly relating to what Councillor Cave was just talking about. You talk about progress being made in making our towns and communities in the Vale more dementia friendly. I mean, how are you quantifying that? I mean, we've heard this now. The last time you presented, you were talking about that as well, which I think was back pre-COVID, and I'm sure COVID has put the blocks on a lot of stuff that you were hoping to do. But how do you quantify that? The other point I want to make before sort of moving on, so I'm not keeping on coming in, is we've had presentations here fairly recently from young people's mental health providers, and the emphasis there is on the partnership working, which you've been talking about, and the no wrong door, so that whoever they go to see, they then get filtered into the system. They get directed to the right services, whichever door they knock on. Whether it's the GP, whether it's the Vale, whether it's Vale Social Services, whether it's yourselves as a UHB, through the wards, through the hospitals, or through the clinics, or whatever. And through the carers, through care workers as well, which people who are meeting individuals who may be progressing along the path towards dementia, but when they first became involved weren't demented, but they are now have concerns about that. So it's a matter of accessing all those, and that then flagging up to everybody. This is an issue. This is becoming an issue for this individual, rather than having to go, well, if I want this sort of care, I've got to go there. If I want this sort of support, I've got to go there. They knock on the one door and someone will turn around and say, right, you need this, you need this, you need this, you need this. I will sort it, rather than it having to be done by poor Joe Bloggs, who's the care. I mean, like Janice, I've been a carer of a person with dementia, and having to set up all the different supports can get very confusing for people. So yeah, if you could respond, please. Thank you.
Somebody like to answer that? Thank you, Fiona.
I mean, I wonder if both Chris and Dan just briefly around the no wrong door element, but I think also Chris, the memory link workers, once somebody has a diagnosis, would provide exactly the support that you're highlighting, Councillor Thomas, around helping carers navigate the system, with the person. So I think that role is particularly pivotal in that regard. I don't know if Chris and Dan just very briefly just want to highlight what's our approach to no wrong door.
Dan, I'll let you go first.
Thanks, Chris. I was just going to bring Marianne in there because I know there's been an awful lot of work in that field in the mental health services older people team around single points of access. So, Marianne, Did you want to come in and just talk about that a bit?
Yeah, I guess there's two elements to it. There are times when people with a cognitive impairment or an undiagnosed dementia come into hospital, And at that point, someone who's looking after them might flag that there's something not quite right. So we have a designated service for people with mental health conditions on the general side, and it's multidisciplinary in approach. So there'll be a kind of a full assessment and support when that person is in a medical setting, which sometimes can be the worst place for them, taken away from their home environment and placed in hospital. So the idea of that team is to see them as early as possible and to get them home or discharged to the right place with the right support. So part of that job is to signpost either to the memory team or into mental health services. So that's kind of in the inpatient setting. But then in the community, we've got something similar, which is the community liaison team. And equally, they reach into community resource teams, GP surgeries, they go into cluster meetings, so that if somebody's got a query or they're not quite sure about something, they can either offer advice or they can go out and see that person and offer time-limited support to families and to the person to prevent them either coming into mental health services too early or, you know, take a kind of collaborative approach to supporting that person at home, and they can link them into Solace, which is the carer support, or various third sector organisations as well. So there's two things really in the community and at home. And in hospital, but there's also the dementia training team who are there to provide various levels of training to all healthcare staff, local authority staff and the third sector, so that people can interact and be trained at various levels. So if they do see somebody who is struggling, they know how to kind of interact with them and they know which best approaches work. So there's lots of support there available.
And I think one of the, if I could just come in just at that end of that question, one of the things that we have to aim to achieve is the reach of these services, and so that everybody that experiences this have access to these types of services, and that everybody, all professionals, then know how to refer, which is your no wrong door, Councillor Thomas. So that's what we're aspiring to, and we have to keep working at it, to achieve that.
Thank you. We can't see you, Joanne, and I'm sure you're very pretty.
Sorry, can you see me now?
Sorry, Chair, you're on mute.
Yeah, I was just saying that we couldn't see you, Joe, and we miss seeing your lovely face. So if you could move the camera, the computer over so that we can see you both, that would be lovely. There you go. Very nice. Can I bring in Councillor Marianne Cope, please?
Oh, thank you very much. Hello, Fiona. Nice to see you, and thank you for that. Really, thank you. Thank you for that really interesting presentation. I've got two questions now. One of them might not be quite straightforward, but and this is evidence anecdotally that I've heard from people that yes, you've got wards with beds, but there is a problem in accessing those beds. So, for example, a person with dementia is admitted to hospital and they're assessed. I'm not talking about people who aren't assessed as needing a dementia bed. I'm talking about those people that have been assessed as needing a dementia bed. Is there a waiting list, do you know? And has anything changed? Or as I said, this is anecdotal, so I don't know if the situation's still the same, because I'm very conscious that those patients probably can't be discharged quickly, and therefore they're taking up a bed in a medical or a surgical ward. And the second thing, it might not be part of your remit, but I was interested to hear about the support for carers, which is obviously really important. But what I'm hearing all the time from people, both friends and citizens in the community, the big problem they have is trying to sort out things for the person who's got dementia, because they haven't got things in place like power of attorney and all of this. And I don't know if you're doing any preventative. You said about educating the community in dementia and everything. And I think the community, generally speaking, the public are a bit nervous about putting things in place. But it is an absolute nightmare if you haven't put things in place, because you just can't deal with everything. And I wonder if you've come across that in supporting carers. So that's part of the question. And also, is there any public health work that you're presently doing or could be doing about that, you know?
Thank you. So 2 questions there. One around about the need for a dementia bed. I'm going to bring Dan and colleagues in, because it's, I guess there's the discernment about when does somebody need a specialist mental health services for older people bed, and when can a person be in the generic clinical system, but they have liaison and outreach. So if I can bring Dan and team in to answer that. Chris, I don't know whether as part of the carer support arena, there is something around being prepared. You know, if at any point your relative or yourself may experience dementia, and I don't know whether that's something we need to investigate or whether you could respond to that. I think it's some of these arenas, Councillor Kaup, sit in the wider regional partnership board and set of endeavours rather than as a public health initiative, if that makes sense. But so if I could bring Dan and team in and then bring Chris in to answer your 2 questions, hopefully.
Thank you.
Thanks, Councillor Kaup. Yeah, it's a really complex piece of the work that you've described, really, the multiple kind of interfacing agencies, and you know, where patients go from inpatients beds is really critical to allow new patients to be admitted, for example. And obviously, if we've got delays within the system with packages of care and you know, moving into sort of nursing or residential homes as well, that can be a challenge as well. So just to reassure you, I met with the director of social services this week from the Vale of Glamorgan, just to have that conversation about how we support each other to facilitate those moves across services. But I'm just going to bring Joe and Marianne here, because they can give you a bit more of the operational detail around some of those elements. Thanks.
You're going to have to catch up, you two, because we can't see you. That's lovely.
Double act. Yeah, in terms of the beds, I won't pretend it's not a challenge. It's beds throughout the hospital sites are always a challenge for everybody. And sometimes people are in a medicine bed and they've been assessed as needing a mental health bed, in which case we will have a team, the liaison team that Marianne's talked about earlier. They will go and see on a daily basis the patients, and they will work with the ward staff in the meantime to help to look after the patient until they are ready to come over to mental health services for older people beds. In terms of the beds with us, we don't ever use, well, we very, very rarely use an out of area bed. I think it's been years since we've actually used one within older people's services. So we do manage the stock that we've got, the bed stock that we've got. It is quite tight, but yeah, it is a challenge. But I think that with the liaison team, with React service as a backup support, so when people are discharged, they can go home with React support, so they don't go home and that's it. We also have a working relationship with one of the charities called Mental Health Matters, who support patients when they're coming up for discharge, as well as when they are discharged, and when they're actually just newly admitted onto the wards as well. So there are a lot of things there for support with patients, but I won't pretend that beds aren't an issue and it's all rosy, but it is a challenge. But we do currently manage our beds quite well. In terms of Marianne?
Yeah, I just wanted to say that usually the people that end up coming to the mental health services for older people beds, there's usually a degree of instability and high risk for those people, because we know that the sooner people are in a kind of institution or a care home, the health outcomes are quite poor. So what we find is that we try to keep people at home for as long as possible with the community support, and then people tend to come in as an absolute last resort, and usually they are quite complex and difficult to place. And as Dan alluded to, placements for that kind of level of complexity are really rare. So we find that that's where our admissions are quite long, and people have to kind of deteriorate physically and in terms of their mental health before they're placeable. So there are kind of delays associated with people coming into hospital.
Yeah, and this is a great strain on the carers. Does that answer your question, Marianne?
Yes, it does to a certain extent, and you may not. I don't want an answer now, but there might be a piece of work there in the future to think how, dementia patients, how much longer are they staying in hospital beds as opposed to other patients, because that's the evidence then, isn't it, that you need more dementia beds, if you like. But I wasn't able to find any research which related length of stay to dementia. So I don't know if there is anything about that, but that might be something that might be worth looking at in the future. Thank you.
Dan, Dan, have you got any knowledge about length of stay for that arena?
Yeah, so we've done some national benchmarking around that, and Joe will be able to talk about that a little bit. But the critical thing for us, I guess, it's less about having more dementia beds, and it's more about having more appropriate placements for the individuals to go to. What we don't want is people sort of almost warehoused in hospitals where they don't need to be. It's about getting them to the right place in that journey at the point that they need it, whether that's at home with the carer support or whether it's into the right placement. But we've had some work around a national benchmark, and we've tried to match our bed profile to much closer to the national profile. Joe, Tim, I don't know if you wanted to come in on that particular point, or if you just wanted me to talk a bit more about it.
We actually we benchmarked as quite high in terms of the number of beds that we've got within Cardiff and Vale compared to benchmarking peers. We haven't done that benchmarking exercise so far this year. It's due now, but what we have found is that it's the right beds rather than just having a whole number of beds, and also, as Dan said, that wraparound service. A lot of carers. A lot of our admissions are around carer breakdown, which is completely understandable, especially during COVID. The last 3 years, have been horrific. So what we've got to do is we've got to build our services around the carers and the families, not just the person with dementia. Somebody with a dementia doesn't necessarily need to come into a mental health bed if they're not showing challenging behaviours and extreme mental health needs. There are things out there in the community, and we're hoping that more and more of that support service and that wraparound is being developed year on year. And the work that Chris is doing with the partnership that's really going to help us, because that's our network. And I think carers are really going to benefit from all of this, just having that wider network availability.
Thank you. I knew this was going to be a big topic, and we haven't really allowed enough time. I will allow a little bit more time, but we do have to move on quite quickly to allow everybody that wants to ask a question. So try not to repeat things. I'm sure you won't. But can I bring in now, please, Councillor Julie Lynch-Wilson?
Thank you for a very interesting report. I work with people with dementia, so it's very interesting to find that there's new innovations. I've worked at the same place for 7 years, so I can say that things are moving. We do treat dementia as not one overall thing, that there is various levels and various types and how we deal with people. So that is good news. It's always nice to hear in innovation. Also, there seems to be a big taboo. It's one of the taboos about talking about dementia, and I find over the years that the families hold on as long as possible before they seek help. So it really needs encouraging for people to come and have, because people can live very good lives for a number of years with dementia, but they need the medication, they need everything that goes with it. So we need to batter down those, and how we look after the families, because very often it's the carers that because the family member is safe, they're in our care home, it's the families that are struggling. So there's a lot to it, but I'll leave it at that.
Thank you, Julie. Yes, I think that is what everybody is striving for in the PowerPoint that they gave us today. Councillor, who is next? Councillor Robert Fisher, did you want to come in?
Yes, I was aware really of how much time we were taking up on this topic, so
That's
I was
okay.
going to, and it wasn't
It's
my.
important.
I was really more of going to make a point than ask a question. It wasn't specifically related to dementia. I was going to speak about, I suppose, very briefly, related to my own personal experiences. And one of the issues that I found when I was caring for my father was that although I suppose I consider myself a reasonably well-informed individual, it was really difficult to keep a track of everything that was available. I was told that X was available, Y was available, Z was available. You'd have to go to this website for that, ring this telephone number for something else. And it became very, very confusing. And what I think, and that could be exacerbated tenfold for somebody who's perhaps elderly with their own issues as well. What I felt was, what I really needed was a one-stop website, or even better than that, an individual that I could speak to and say, right, I need help with this. And this person could help me direct or possibly do something for me. So it was more of a point really than a question that I had.
Councillor Fisher. I'm going to bring in Councillor Gwyn John, and then I'm going to bring in Councillor Good John. If you could make it brief, and I know Councillor Gwyn has a lot of experience with dementia, so
I'm quite prepared to wait until all members have spoken, Chair. You're muted, Chair.
Thank you, Gwyn. Councillor Emma Good John.
Oh, sorry. Thank you very much. I cared for my father as well, and I felt it was most vulnerable when he was in hospital, because he was away from familiarity and he was away from care that he was used to. I was just wondering on ward support, whether what sort of support you were actually giving, as in like just the basics of just making sure that they had a drink that they could reach and that they had food that was cut up or not cut up, just the basics. And I was just wondering whether that was supported in your wards and when they were not in a dementia bed. Thank you.
I don't know. Sorry, Councillor.
Thank you, Councillor Good John. I think that was covered in the report, was it not?
Just to mention, there's a lot of work in the inpatient setting, and one of our assistant directors of nursing has taken a particular role in championing that with directors of nursing right across the hospital. I don't know whether if somebody wanted to come in and add to that.
I think there's a lot of work that's been done. I suppose that I was talking earlier about the liaison psychiatry service, but I guess somebody would have to be referred to liaison psychiatry to access that support, and there are healthcare support workers that can become involved in the care, but I guess their role would be to upskill the staff around those special requirements. There's a big drive for Read About Me's to be completed, or This Is Me. The UHB have adopted Read About Me, and there's lots of campaigning going on to encourage the ward staff to complete those forms, and also to bring back John's campaign as well. In the pandemic that stopped, but I think there's a big drive to bring carers back onto the wards to help out with care, which I think would be a good solution to that issue.
And those are exactly the basics, to support the basics with the preferences of the individual person.
Thank you very much. I have a few quick questions, but you can send me the answers if you like, because we are running out of time. You did say that it's going to be person-centred care delivered locally with kindness. Carers will feel supported and empowered. And I think you've covered how you're going to do that. But as a past carer, they're going to need an awful lot of help. How will the risk of dementia be reduced? I'm interested in that because I don't think you really covered that. And crisis will be avoided because 56% of people in the Vale are over 50 years old. And when do you think that everything that you've put forward is going to come to fruition? And I'd like to know where the 6 wards and the 84 beds are.
Shall I just come in on the preventative piece? I mean, this is a partnership plan. So, I mean, all of us, I guess, are involved and engaged in how we try to reach the vision. Well, we didn't go into detail. So sometimes we bring separate arenas of work to you on preventative work. And you'll know that in our Public Service Board plan, that Move More Eat Well, it's not a campaign, it's a whole programme of work to try and support and encourage and create the conditions that people can live well. And that includes children and young people through to teenagers, through to adults, through to older people. We have a lot of effort and into that arena in partnership, really well supported by Vale Council. And, you know, a high percentage of dementia cases, I know colleagues will know in the room, is around Alzheimer's, and keeping strong and good cardiovascular health is absolutely key to that. So part of our wider population and public health plans are all corralled and supportive to try to support people to keep healthy, both in creating the right environments, making it easier, and just encouraging, motivating and supporting. So that's probably the preventative piece. The beds, Dan.
Thanks, Fiona. So most of our beds are up in University Hospital, Landock. We've got a very close group of beds, group of wards, which are all aligned along the east corridor. We do have one young onset dementia ward as well, which is currently based at Barry Hospital, and it's co-located with the young onset dementia team as well. And up in Landock, we've got a wide range of other services here as well. So as I say, it's not just about the beds, it's about the other range of services that we deliver here as well. So on site, we've also got our co-located community teams and our React team as well. I'll just let Joe and Marianne come in there because they'll have some more detail around some of the other aspects. Thanks.
Sorry, I just know that we're short on time, but I just wanted to add, as well as the young onset dementia beds, within that ward, there's one respite bed, which gives carers and families a well-deserved break, which can be pre-booked. And that's something that, as part of our day service and crisis development, we'd like to look at how we can roll that out across the UHL wards as well.
Thank you. Thank you very much. Gwyn, you ready to come in now?
Yeah, just quickly, I'm not going to keep you. I could talk to you all night about dementia, as I've got so much experience of it. But what I would say is the diagnosis of dementia, I was let down badly by the local GPs. I took my wife to the GP after she'd had a session of clobidrols for 10 months, which are blood thinners for TIAs and strokes, which she didn't have. And basically, they said, oh, no, she hasn't got dementia. So I insisted on seeing a further consultant. I was sent to Cowbridge Health Centre, and I saw a very good doctor there who asked her a number of questions, which a number were wrong. And he then sent her to have a CT scan in Landock, which diagnosed dementia. And it was a nightmare for the next 2 years. I'm not going into that now, but I think a lot of this could have been helped in the very beginning with the GP surgery. And I can't express it more, that I think what you're doing is excellent. I only wish that this had been around when I went through this terrible time. But all I would say is please emphasize on GP surgeries to wake up, stop locking the doors, and let people in to try and save their loved ones when they need to. I had no help at all. I looked after my wife right the way through until her passing away in 2021. So thank you for bringing this to us tonight. I applaud you. Thank you.
Thank you, Gwyn. I know you had a tough time. I'd like to thank you all very, very much for coming today and answering all these questions. And I wish you all the best of luck for the future in being able to bring this forward as fast as possible. It is going to be such a great help to so many people. And oh, excuse me, I got somebody else very quickly. Ian, Councillor Buckley.
No, sorry, Chair. I was waving goodbye to the speakers.
Oh, okay. Thank you, Ian. Yeah, thank you all very, very much. And
are the committee happy to note with thanks, Chair, for the presentation?
Yeah, I was getting there. Amy. So thank you all very, very much. We note your presentation today. We hope you will come back and update us again very soon. And is the committee happy to note and move on? Yeah. I see no dissent, so I'd take that as a yes. Thank you, Marianne.
Thanks,
thank you,
Councillor Charles.
As I say, I can't thank you enough for all the work you're doing. Thank you very much.
Thank you, and thanks to the team that presented. Thank you very much. Bye.
Bye-bye. Right, everybody. The next report is for noting. I'm sure you've all read it. So unless Lance wants to speak on it, I know he's open to for anybody to ask questions. Did you want to say something on it quickly, Lance?
No, I was just going to refer members really that the timetable that's mentioned in the report is at paragraph 2.13, and so assuming that everybody is happy, then as it's a referral from cabinet, that it will just be a question of feeding back any responses we had to cabinet. So yeah, I'm assuming that that's not the case, but sorry.
Yeah, thank you. Does anybody have any questions they'd like to put forward on that? Yeah, Councillor Neil Thomas.
Yeah, it's not a question, Chair. I just it's a comprehensive report. As you say, we have already. There's not much more to comment on in these terms, so I move we note.
Yeah, thank you, Councillor Thomas. I agree. So is everybody else happy to note? I see no dissensions, so I take that as read.
Are you happy to second, Chair?
Yes, of course. Yeah, second, Councillor Thomas. So we're moving on to agenda item 6, which is Kath Doman presenting with Meredith Gardner. They are NHS colleagues once more, and it's on the joint ERA plan.
Thank you, and good evening, committee and Councillor Charles. We're pleased to bring tonight the Regional Partnership Board Joint Area Plan that covers over the next 5 years for consideration at Scrutiny Committee tonight. This is a really important document in the work of the Regional Partnership Board, as it sets out the partnership's commitments over the next 5-year period. And it's really good to follow on from the dementia deep dive that you've done this evening, because that's just one area of the work of the partnership. And as you'll see from the plan, the plan covers many areas equally complex as the work that we're doing as a partnership around dementia. So you'll get a sense of the even though it's a fairly short and brief document, you'll get a sense of the depth and range that it covers. I'm going to give you a bit of an overview around what the plan's all about and its purpose. And my colleague Meredith Gardner will give you a brief guided tour of the plan itself, so you can get a sense of the whole. It gives us an opportunity every 5 years to really do a bit of a stock take as to the work of the partnership, and to consider what the needs of our population are and the ability of our collective services to respond. So it's informed by, and you'll be familiar with these major documents, the 5-yearly population needs assessment and also the market stability report. So that gives us some context and gives us some evidence as to what the issues are, what's changing, how we need to plan as a partnership in terms of the delivery and development of health and social care services across our region. It's really important to note and understand that this plan doesn't cover the entirety of everything that local authorities and the NHS and the third sector services do in our region. Its focus is on what we need to work on together to be able to make the changes needed to improve outcomes for older people. So it's very much in that partnership space. It's written in the context of the plans of each of the partner organisations. So the Vale's own plans and those of the other partners, Cardiff Council and the Health Board in particular. And it doesn't start from afresh every 5 years. It really builds on and extends the work that we've already been doing. And you've seen the dementia plan tonight. Other major areas within it are our at-home programme, which is all about how we develop integrated community-based services to enable people to stay close to home and be as healthy, well and independent as long as possible. It covers the work around our children and young people services with emotional wellbeing and mental health services needs and so on and so forth. We've organised our plan and our work as a regional partnership board into 3 major themes. So we've started to think about themes around starting well, living well and ageing well. So that helps us as a partnership to focus on what it is we need to do together and to think about, for instance, what it would take to enable older people to age well in Cardiff and Vale. And that's clearly beyond any single organisation, and it takes a partnership and indeed the communities to be able to enable that. So it's really in that context, very broad brush approach to improving services and outcomes for people. There are specific plans for people with particular needs. So it does cover carers, people with learning disability, people with autism, children, young people, older people, dementia, and so on and so forth. The list is covered in your report. And we also consider how we're going to work together on the big enablers of change, so the things that help us deliver services. So our workforce is fundamental to that, digital solutions and technology, capital developments, commissioning and so on. Our capital developments aren't covered in the plan. There's a requirement to do a parallel 10-year strategic capital plan, which we're developing at the moment, and that will sit alongside this plan. And we're now in the process of taking this 5-year plan and developing the detailed annual delivery plans. So you'll get a sense of the whole from this plan, but the detail is in those annual delivery plans. And as a final point, just before Meredith gives us a brief guided tour, the final draft of the plan has been approved by our Regional Partnership Board, and you'll know Councillor Eddie Williams is the current chair of the Regional Partnership Board. So it's been approved as a final draft, and we've been taking this through all of the governance routes of each of the partners. So it's really important that each of the partners are aware of it and endorse it and support it. So it's gone through the scrutiny process of both councils, through the Health Board's board and to the 2 Public Services Board as well. And I'm really pleased to report that it's been received really positively across the partners so far. So we'll seek final approval of the plan at the Regional Partnership Board in July, and then it will be submitted to Welsh Government. And of course, that's when the work really starts, doesn't it? So I'm going to pass over to Meredith now. She'll give you a brief guided tour. I hope you enjoy it. It's we're quite pleased with what we've managed to pull together. It's a very complex world. And I think we've managed to present it in a nice straightforward way that's fairly easy to engage with. Thank you. Over to Meredith.
Thanks very much, Kath. I'm just going to share my screen for a little minute. I believe that the draft area plan has already been circulated, but I thought it would just be helpful just to sort of just try and help just to navigate your way around it. So if I share my screen, just give me 1 second. Here we go. So as can I just check that you can see my screen? I'm not hearing anyone.
Yes, we can see the screen.
Wonderful. There we go. Great. So as Kath has said, we're splitting the plan. Covers a range of priorities that are to a certain extent dictated by Welsh Government, but of course at a local level we are allowed to add in our own specific areas where documents like our population needs assessment and our market stability report have suggested that we need to pay particular attention. And as Kath has also said, we're divided those priorities across 3 key life stages within starting well, living well, and aging well. And so each of those priorities are colour coded to where they sit within those life stages. We have undertaken quite a degree of engagement when we've been informing each of those priority areas, and we've been very lucky in that we've been able to take forward engagement with a range of service users, very often with lived experience of the particular issue of concern to them. So say, for example, people with learning disabilities, perhaps unpaid carers. So we've been able to take the views and experiences of these people on board, as well as also listening to members of staff and also colleagues across our public service boards, the RPB, the PCPGs in both Cardiff and the Vale of Glamorgan as well. So we've been able to reach out to a wide range of stakeholders to help us in formulating these commitments. And again, as Kath is saying, what we've really been trying to centre down onto is the big areas where working together we can hope to make the biggest impact for people across our region for these particular priority areas. So just to give you a very brief overview for each of our commitments, these are summarised on page 3 of the document at a very high level. And then what we do is that we give a little bit more detail of each of those commitments and what we want to do with them in subsequent commentary. So, for example, on page 17, we have our commitment to people with learning disabilities with a key kind of statement promise of what we want to be delivering over the next 5 years. And then we've got an outline, firstly, describing why we have come up with this particular commitment, why it's a particularly important area. And here we've tried to give and pull out the main areas and pieces of information that have been supplied either through our engagement, through our P&A, our market stability report, and just some of the other guidance that has come down from Welsh Government and also local policy that's been developed by our partners. So that helps to give the context and the reason why we are focusing on this particular commitment area. And then the second box along talks about actually what we're going to be delivering. And some of this is a continuation of work that began in our first area plan. And some of these are new deliverables that we think we absolutely need to be focusing on because that's what the P&A and our engagement has said that we need to be doing. So generally, the things towards the top of the list are the things that we are going to be continuing, and the things that we're adding into play are the things towards the bottom of that list, just to give you the context. And then finally, all the way through our engagement and our thinking about the area plan, people have been very, very keen to make sure that we are clear on what our outcomes will be as a result of doing this work. It all sounds like very lovely motherhood and apple pie, but it's nothing if we don't actually, or if we're not able to demonstrate the difference that we're going to be making. And particularly for people with learning disabilities, it was really important, as I said earlier, that they have been involved in a lot of the conversations leading up to this work. And it was very important to them to be able to understand and identify what the difference was going to be as a result of putting these changes in place. So we've tried to be very, very clear about what that will mean for people with learning disabilities, and wherever possible, trying to add in some very clear deliverable outcomes that where at all possible, they're measurable and things that we're going to actually be able to see and count and come back to people like yourselves to say, well, we said that we were going to do this, and this is the progress that we have made, and this is how we know that we've made a difference. So that's how each of our commitments across each of our life stages have been developed, and hopefully you'll have had the chance to have had a look through the remainder of that document just to get your areas of particular interest. It was very useful actually to be listening into the subsequent conversation on this agenda, where you were considering dementia and unpaid carers. Particularly, there was a lot of interest in the carers role for people with dementia. And that ties in very nicely with the area plan, because if you go to the dementia area, the dementia section, and also the unpaid carer section, hopefully you will see that the themes and the deliverables that we've identified there are chiming with the conversation that you've just had with our colleagues on those areas earlier on in the meeting. I'm just going to take my screen down for a little minute. As Kath has said, we are in the process of developing a delivery plan that's the companion piece to the area plan. I've tried to find a different word for plan, but I've been unable to find it so far. We'll keep on trying. But the delivery plan is very much the companion piece, and it's saying, okay, so what are the enablers that we must have in place? And also, what's our timescale? What do we think that we're going to be delivering this year? And also, in terms of the other deliverables that we've said that we want to achieve, when do we start working on those, and when might we actually start to be seeing an improvement over the 5-year lifetime of that area plan? So, Chair, I think that's probably enough of a context setting, just to remind you that we're bringing this plan and seeking the endorsement of the Scrutiny Committee tonight, and we'll be very pleased to try and answer any questions and listen to any observations you may have. Thank you.
Thank you. The report has been brought to us to make us aware of the regional plan that you have, and to ensure that us as a committee have had the opportunity to propose any amendments or improvements to the plan prior formal approval. So I thought it was a very, very interesting report and well put together, and thank you both very much for it. So does anybody, the recommendations are that the Scrutiny Committee consider the joint area plan commitments, and that the Scrutiny Committee provides feedback regarding the content of the plan prior to its approval by Cabinet. So does anybody have anything they'd like to add or share? Councillor Neil Thomas.
Yeah, thank you, Chair. I agree with you. It is a comprehensive report, and there's a lot in it. In fact, it's going through. It was difficult to find any holes. There's no mention of South Wales Police in there, and their contribution as or potential partnership in this. And we read recently about Metropolitan Police's declining now to get involved in mental health incidents, whereas we know that police are often called out locally to help relieve a situation which could possibly escalate were they not involved, and supports mental health social workers and families and communities where people are behaving badly. I mean, the Metropolitan Police thing I find extremely alarming, and I'm wondering whether we ought to be talking to them a bit more in South Wales Police and involving them and getting a strategy that works for South Wales that clearly doesn't work in London. The other thing I would like to see within the report is kind of more of an emphasis on young carers. Other members of the committee will be aware that young carers are one of my bugbears. That I do like to see special mention and emphasis on young carers who have special categories of need within the community and needs specific support. I know that there's good stuff going on with them, but I would like that. I would very much like to see that incorporated in this plan. Thank you.
Thank you. So are you happy for us to add that? Because we will be adding it both to your plan.
The reason I raised it is to add that, yes.
Yeah. Okay. Thank you. Councillor Marianne Cope.
Thank you, Chair. Thank you for the opportunity to comment, because it says the committee's you're seeking the committee's views on this plan. Yeah. It's obviously very comprehensive, and my understanding is that the council, and I'm sure the health authority, has tried over the years to implement many of the proposals that are in here, maybe unsuccessfully, perhaps due to limited resources or possible other factors. And I'm wondering, what differences we can put in place this time to address those issues. So, for example, increased carer assessments, more timely hospital discharges. This is a situation, hospital discharges, that's been going on for years and years and years. We never seem to get on top of it. So that's just for thinking about. One thing I did pick up in the plan, which I didn't see there, was about the Carers Gateway. I know that the recent report, HIW, picked up that not all carers are aware of the Gateway, and I wondered if there was something in the plan to sort of publicise the Gateway to make more people aware of it. So that's about the plan. But as regards this committee, I'm wondering, is there a date for completion of the delivery plan and the outcomes monitoring? And if there is, and I'm assuming that the outcomes monitoring will be measurable, smart objectives, targeted. If there is a date, what is that date, and will it come back to this committee?
Thank you, Marianne. Cass,
thank you.
Be answering that.
Yeah, certainly. In terms of the outcome monitoring, we already do an enormous amount of outcomes monitoring. It's quite a dark art, quite difficult to do, especially across partners. We've actually just launched in the last week our regional information sharing site, which helps us monitor the 8 outcomes that the Regional Partnership Board has established as being important for our partnership. But within each of those 8 outcomes, we put a mix of live data that's updated almost on a weekly basis, and also some static reports. So we're getting much better at understanding what outcomes we're trying to achieve, and what are the indicators and performance measures that tell us that we're getting there. And of course that's about the endeavours that we work on together as a partnership, as opposed to as individual organisations. So that outcome monitoring is ongoing and continues, and we actually submit reports into Welsh Government on a quarterly basis as a regional partnership board. We also, every January, it usually is, we bring the annual report into Scrutiny, which sets out the work retrospectively reviewing what the Regional Partnership Board has delivered as a partnership, and that is full of not just facts and figures, but also a lot of videos and case studies of the experience of the people that people have of the changes that we're putting in place. So that's the main way that we report into Scrutiny on an annual basis, and give you a retrospective view as to the work that we've done together as a partnership. In terms of the delivery plan, I'm racking my brains. Meredith will know this. Do you want to talk through the actual delivery plan and the deadlines for getting that completed?
Yeah.
Thank you.
Yes. So the delivery plan is being drafted at the moment and will be coming to the Regional Partnership Board at its next meeting in July. And then, as I said, it's something that will be continued to be checked and scrutinised on a regular basis following that over the 5-year lifetime of the area plan. So very, very happy to bring both that and the kind of a regular update on how we're doing with the area plan overall to you. That will be absolutely fine. We'd love to do that. I wanted to pick up a couple of comments just on the questions that you've both raised around unpaid carers, and particularly the councillor's question around an emphasis on young carers. So you might have seen within the unpaid carers section, there is a commitment to take forward the charter for unpaid carers, and the unpaid carers charter was launched just a couple of weeks ago. Some of you might have joined us in Cardiff when we were launching that. but I know that behind the scenes we're in the process of pulling together the charter, and it's basically the same sentiment and the same commitment behind the charter, but it's being launched in a way that will be more palatable for young people particularly. And the launch of that particular, it's just the way in which we're presenting the charter and raising awareness of the role of unpaid carers. And that particular piece of work is being focused upon schools within Cardiff and the Vale of Glamorgan, again to raise awareness of unpaid carers and their role, because so often that goes unrecognised and misunderstood by young people themselves and also the wider community around them. So again, it is about trying to raise awareness of young unpaid carers at school age across Cardiff and the Vale of Glamorgan. That's one of the first steps of the Carers Charter. And then again, you were talking about increased carers assessments, Councillor Cowp. And again, that's something that is picked up through the Unpaid Carers Charter, and it is about trying to raise awareness that that service is available. Particularly, you mentioned around the Carers Gateway, and yes, absolutely. So obviously we have funding through our Regional Integration Fund that is available to the RPB, and that is actually what funds the Carers Gateway, that presently you'll be aware is actually based within Penarth. But we are very conscious that we need to raise the profile of that service even further, and we're working with the third sector provider to do that.
Thank you. Thank you.
Thank you. Did you want to come back in, Marianne?
No, thank you very much.
Thank you. Lance, did you want to say something?
I was just going to try and finish it off, really. I think just to let Councillor Thomas know that the issues that he raised regarding the Met Police, they're not replicated in South Wales, as you know now. They wouldn't be part of this plan because this is a regional partnership board plan and the police aren't members of that. I can see Eddie's put a comment in the notes about potentially raising the issues with the police through the PSB, but there is also a separate mental health concordat group that does look specifically at those kind of issues. So I think it is covered outside of this. So I don't think that probably should be reflected in this plan. And I think the other challenge, just to in terms of making amendments to this document, obviously it's gone through other scrutiny committees in Cardiff and through a process in the Health Board. So we have limited scope to change it, I think, in recognition that if other places have thought it was fine, then we couldn't make massive changes. I know you're not suggesting massive changes, but I would propose a pragmatic way forward. To me, there would be to reiterate within that where it's referring to unpaid carers, that includes young carers, and that there is a separate part of that charter, which I know you've seen because it came here, didn't it, the charter, but we can refer to that in order to make it manageable without changing the spirit of the document. I'm hoping that seems like a sensible way forward too.
Can I just come back? Yeah, you're right. I mean, but there are a couple of mentions within the document of young carers. I just wanted it to be higher profile within the document. But yes, more reference to young carers and where they can go and what they can look at, so that they aren't. It just doesn't get lost in the avalanche of words. Thank you. And as for the police, yeah, I mean, that was, I take that as understood. Thank you.
Okay, so we can take the police out of the additional in the report. Thank you. As I say, thank you both very, very much, and thank you, Lance, for your input. The recommendations are that Scrutiny Committee consider the joint area plan commitments. We all happy to do that? Thank you, Neil.
Yes.
Thank you, Marianne. And that the Scrutiny Committee provides feedback regarding the content of the plan prior to its approval by Cabinet, which I think we've done admirably. So thank you.
May I just confirm, are you happy to provide, obviously you provided the feedback this evening, Chair, to Kath and Meredith.
Yes.
Are you happy to leave it as that for now, so the committee are noting for this report, not sending any specific feedback anywhere?
Well, as long as Kath and Meredith are happy with the comments and take them on board about the young carers, and do highlight it. Lance, did you want to come in?
I was just going to advise, I didn't refer to it in the report because I wasn't 100% certain of the mechanism at the time, but we will go to Cabinet for formal approval, but we wanted it to come here so that the Scrutiny Committee had an opportunity to make and suggest any changes. So Kath and Meredith will make the amendments following the feedback tonight, and then a new version will go to our Cabinet for approval.
Thank you very much. So the Scrutiny Committee, we've provided the feedback and we're happy with the plan commitments. Yep. Okay. Neil has approved and I second. Oh no, Marianne second. So that's lovely. Thank you both very, very much. See you soon, hopefully.
Thank you very much.
Thank you.
Thank you.
Thank you. Good night.
Bye-bye. Which takes us on to agenda item 7, which is the Family Information Service Annual Report 2023 from Becky Wickett. This is to note the report. This is actually an annual report, which is hopefully bring back to us again soon. So, Becky, nice blue screen I've got.
Oh, sorry.
There you go. We got it.
Is that okay?
Yeah, lovely. Thank you.
Great, thank you. Yeah, good evening, everyone. My name is Becky Wickett, and I'm here to share with you our Vale Family Information Service annual report. So hopefully you've had a chance to have a look through. What I'm going to do is just summarise it and just highlight some things and take about 10 minutes of your time. So thank you for inviting me. So our Vale Family Information Service is where we connect families with childcare services, support and activities for children and young people across the Vale. I'm the Social Care Information Team Manager and I manage the service. We're a small team within the Social Services Directorate and in the Resource Management and Safeguarding Division. So I'm going to explain a little bit about what we do, our achievements over the last year, some of the challenges we've faced, and then actions going forward. Okay, so we're a one-stop information service for parents and carers and professionals working with families, and we provide information and guidance on a whole host of things that matter to families, but primarily on childcare, help with childcare costs, which includes the Welsh Government 30-hour childcare offer for 3 and 4-year-olds, groups and activities and support for families. Over the last year, we've responded to 1,619 inquiries, which is a slight increase on the previous year. Our information is only as effective as our information database. So we maintain a directory of services via the Dewis Cymru website. So we ensure that that information is up to date. It's available to the public, and that's over 500 services. They're reviewed every 6 months. We help the local authority meet their duties within the Childcare Act 2006 and the Social Services and Wellbeing Wales Act to ensure we have an information, advice and assistance service. So within that IAA service, we actually form the I, so the information, and then what we do is we work closely with the Families First advice line if families need a bit more advice and support, referral onto services, and we also work closely with our intake team if they need actual assistance. So whatever entry point a family comes into, we will work together to make sure that we're responding to families' inquiries and needs. As I mentioned, we do promote the Welsh Government 30-hour childcare offer. We receive funding to employ an engagement officer and an assistant. So we work with parents and professionals to make sure that that's promoted. So that's for childcare funding for parents in work or those in education and training for 3 and 4-year-olds. We also receive funding through Families First to administer the index for families of children and young people with disabilities or additional needs. So it's like a register, and we've got over 1,000 children signed up to the index. And over the last year, we've had a real increase in registrations from the previous year. Once signed up, it means that families receive our newsletters and e-bulletins about services and support locally that they can access. We also support childcare providers by keeping them informed of funding, training, any changes in legislation, and obviously we can promote their services to parents who contact us. And through our inquiries, we can also help inform the planning of childcare and also promote childcare as a career. I just wanted to share with you a bit of a more complex inquiry, just so it kind of brings it a bit more to life as the sorts of inquiries that we receive. So this is a particular one where a Ukrainian mum has a 3-year-old child and was placed with a host family. So the host actually contacted us. The parent was trying to access an ESOL course, English for Speakers of Other Languages. She wanted to know whether that meant that she'd be eligible for the childcare offer funding. She also needed childcare. The child was due to start nursery school, so she needed to find a nursery school place, and also wanted general support as well. So we were able to link in with nursery admissions so that the parent could make a late application for the nursery school, and also helped find wraparound childcare as well, which means that a childcare provider could pick up or drop off at a school. We also inquired with Welsh Government as to whether an ESOL course would mean that the parent would be eligible for funding, and they were. So the FIS officer helped them apply for the childcare offer funding. And then the outcome was that the child started nursery school in January. They accessed childcare in Cowbridge that was able to offer that wraparound service that meant mum could start doing the ESOL course, and she was able to gain funding through the childcare offer. And we could also provide information on other general support. So that's one of our kind of more complex inquiries, but shows the breadth of information that we can provide. So just briefly, just looking at some of the achievements over the last year. So I know I've mentioned this childcare offer. A new national digital service was launched and implemented across Wales. So we had to ensure that it was effectively rolled out to timescale. So 380 children are now receiving this childcare offer funding via the new system, and 132 providers have registered. It means that we now operate an additional telephone service, as well as our family information service helpline. And over the last academic year, 1,048 children are accessing the childcare offer, which when you look at the birth data is just over half of all 3- and 4-year-olds. We also work closely with the Healthy Living team. You may have heard of the Summer of Fun programme. The funding was provided by Welsh Government to put on a whole host of free activities for children during the school holidays to help with the cost of living crisis. So we helped curate that information and provide an online programme which covered over 3 months. And yeah, it was a huge success and generated more than 28,000 views to the webpage. We've been able to really increase our outreach in the community and really looking at working with employability partners, including Communities for Work, Job Centre Plus, Adult Community Learning. So it's looking at really helping parents back into work or access training. We can help support them to find childcare, because that obviously can often be a barrier, help them with information about childcare costs. And we work closely with Flying Start to really help promote the rollout of the 2-year-old childcare offer. We're receiving lots of inquiries about that at the moment. And our outreach officer organised a really successful event in Barry Library where we could get lots of partners together. We had over 80 parents come along, and we provided a free children's book as an incentive as well. And we're going to be doing that in other areas of the Vale. And I've mentioned the index. So again, the index is where we can provide information to families who've got children with disabilities or additional needs. So we've been working really well with the Families First advice line, where they would refer families onto the index, and those referrals have increased by 46%. Our summer newsletter will be coming out in the next few weeks, and it's hard copy in the community and also a digital flip book as well. So just briefly, some of the challenges that we have been facing. So we have had an increased number of childminders that have deregistered, and settings are struggling to recruit childcare staff. And we have had some inquiries where we've struggled to find sort of wraparound childcare in certain areas. So we're really working with our colleagues in the childcare and early years team and the sector partners to look at like a recruitment campaign. There is funding as well from Welsh Government for certain training and things like that. So we're really working with colleagues to help support that. Another challenge is an increase in staff resources. As I've said, just with the childcare offer rollout, it's taken a lot of team resources, but we're working well as a team and with our delivery authority, which is Newport. Excuse me. And with I guess a lot of funding, we haven't had an uplift in our Families First funding to administer the index. We've had an increase of children register, which is an increase in administration. So yeah, it's just to highlight really that we're just looking at, obviously there's an increase in printing and supplies and how we can manage that. To help with the administration, we really like to progress software, which is Power Automate. There are security issues, so we're hoping that they're going to be progressed corporately because that would really help us with our work. Actions going forward. So we're continuing to work with our employability providers and partners to make sure that we can, well, help support parents get back into work and know what their options are. We're working with childcare providers and putting together information packs that they can give to new families that start in their setting, making sure that they know that we're here. Often parents don't realise that they can have help with childcare costs when their parents start, when their children start childcare. We are also working to the Families First Quality Awards, and we're going to be achieving that before the end of the year. And we're working, as I've said, with childcare and early years colleagues to encourage people into childminding and looking at a social media recruitment campaign. And we've improved our digital information. So we're just really looking at the accessibility of that and ensuring that it is accessible to people that are visually impaired. And we're looking at easy read information and things like that. So I've got our contact details. We've got a really active Facebook page with over 4,000 followers. So I'd encourage you to have a look at that to find out what we do. And we share lots of information about other activities and events. And I think that is it. Thank you very much. And I'm happy to take any questions.
Yeah, thank you very much. Once more, an excellent report. A lot of work you have put into it. I mean, we've received this report to ensure an effective oversight of this important area of social services activity, and it is very important area, and to ensure Scrutiny Committee continues to be updated with regard to the Family Information Service. And I think we all welcome this report. Does anybody have any questions? Just looking to see if I got any hands up. No questions, which must mean that everybody's fully happy with how things are going.
That's great, thank you.
And good luck with everything else, especially with the summer holidays coming up. Is the committee recommendation is that Scrutiny Committee considers the annual report of the Vale Family Information Service and the work undertaken to support parents, carers and providers in the Vale of Glamorgan. And I think because of the nobody coming back, I'm sure that means that we all are happy. Neil, would you like to move that?
Yeah, yeah, I mean, you're quite right. Again, it's a comprehensive report. The fact that nobody's got any questions about it doesn't mean we haven't read it. It means that we've understood it, and there's nothing to go on. So I move the recommendations.
Thank you, and I'll second that. And the second recommendation is that Scrutiny Committee receives annual updates on the Family Information Service. So can somebody move that, please? Thank you, Neil. Okay, I'll second that as well. Thank you very much indeed. Go back out now and enjoy the rest of this lovely weather that we have.
Thank you.
You're welcome. Thank you for coming. Which moves us on to agenda item 8, which is to note all the outgoing challenges, to receive a report on an annual basis. And I guess that's over to you, Lance.
It's not actually over to me. I'm going to hand it over to my colleagues, Ian and Gaynor. Gaynor's our commissioning operational manager, and Ian hasn't been with us terribly long, so I think he will introduce it, but we'll probably need to rely on Gaynor for any detail. So thank you.
Well, thank you very much, Gaynor Jones, and thank you very much, Ian McMillan.
Oh, good evening, Councillor Charles and committee. Yeah, so I'm here to present to you the report on the annual review of commissioned services for adults with a care and support need. So the report is going to outline the activity with regards to commissioned services. The committee will have received the report on an annual basis. So it's going to be an update of the activity during the last year, but it's also going to set out the commissioning priorities that we've got for the forthcoming year. So in terms of the background, I'm sure all members are aware that we've got a responsibility under the Social Services and Wellbeing Act that if an adult or someone on their behalf identifies that they have a social care need, that they have a right for a social work assessment to be made under a care and support basis. And should that assessment identify the need for care and support, work is then undertaken with the citizen or their family members to decide what the best package of support would be for them. And those provisions can be many forms of support, from going to a day centre to potentially a placement in adult residential care. And that's really where the commissioning and finance team comes in, that Gaynor's the operational manager for. We work really closely with our colleagues in the locality teams to ensure we commission the right care and to ensure we get the right specialist service that can meet those needs that are identified in the assessment and help achieve the personal outcome that's identified for the citizen. Point 1.2 of the report sets out really, but there's the increase in demand, and that's going to be a factor of this presentation. Really, year on year, we've seen an increased demand in need for commissioned services for adults with Vale of Glamorgan, and not only a increased demand, but also an evolution in terms of the services that people are looking for, and that's the focus of the commissioners. We need to be ahead of the game, really, and being able to identify the services required for the future. Another issue that committee members will only be cited on is the challenge of recruiting into the social care sector. It's been another particularly difficult year in relation to that. There's a myriad of factors for that. Point 1.3 in the report sets out some of those factors, but just to say, the cost of living crisis, the need for care staff to register now with Social Care Wales, working patterns that don't really fit a lot of people's lives, and real responsibilities that comes with working with an industry where you might be able to go to another industry where you'd be higher paid. There is an ageing population. Everybody's cited about that across Wales, but the demographics that we got within the Vale make that particularly challenging for them. We heard from colleagues earlier that people are wanting to remain at home for longer, and that's the right thing for them. But that often what comes with that is the need to deliver really complex packages of care within the home environment, and that's the right thing for those citizens. But also when those people potentially come into residential care at a later stage in life, the package of care that they need is equally complex, and that can be a challenge for commissioners. Another factor, and it was referenced by our colleagues earlier, is the need to be able to support people who have early onset dementia, and there's a growing need that needs to be met. I think we're in a real privileged position in the Vale of Glamorgan, that the fact we have 4 residential care homes of our own, and that's a real asset that we shouldn't downplay. During the last few years, we've actually secured capital funding to modernise those homes and make them more dementia friendly. I've had the privilege over the last couple of months to go and visit those homes, and I've been really impressed not only by the modern decor and the feel of the homes, but also the quality of care that's being delivered within those homes. And that's not only my perspective. We've had 3 CIW inspections that have taken place during the last 6 weeks, and all of those inspections are really positive inspections of the report of the homes. I think the fact that we've got our own care homes is a real positive for us. Not only does it give residents that additional option in terms of that mixed economy of care, but it also gives us an additional layer of capacity, and capacity is really important within in the system. I think, again, just as I've talked about the challenges in terms of recruitment to social care, you'll all be aware about just how challenging the market's been for care homes in general. You will have seen the headlines about there being the risks to care homes shutting down. You'll see in the report at 1.12 that one care home in Vale of Glamorgan has closed. The reasons for that are set out within the report, but other local authorities have been in a much more challenged position in terms of providers. And I think part of that is down to the really strong working relationships that have been established by Gaynor and her team within the Vale of Glamorgan. There are really close relationships with providers. There's a monthly provider forum, which is a real success. It's an opportunity for people to share challenges, to share difficulties, but also to share good practice and to work together in this particular challenging sector. And the fact that the homes have been supported with a 12% uplift during this year to support with the inflationary pressures was also incredibly well received, as you can imagine, by the sector. In terms of recruitment into care, incredibly difficult. As I set out, this year has been really difficult. I think the fact that we've got in place our fast track to care scheme, which is set out at point 1.15 in the report. It's a really popular scheme, and it's a really supportive element in terms of supporting people to enter into the care environment, and really supports us in terms of recruitment. The programme itself offers recruits a 2-week course where they can undertake all of the essential training for them to start working in a care role, whilst all the hard work is undertaken in the background in terms of gaining references, potentially right to work in the UK, and undertaking DBS checks. So that's been a really supportive factor in terms of recruiting into that industry. Quality assurance is a key part of the role that Gaynor's teams undertake. We quality assure all commission service, and we really ensure we need to have robust processes in place. We've all services are subject to regular monitoring and review by Gaynor's team. We hold a joint quality monitoring meeting, which is a monthly basis, and that's where it's a multi-agency meeting where we're able to discuss any providers, where there's any issues or concerns, or to share intelligence. And in addition to that, we've got a regular interface with the Care Inspectorate of Wales where we can discuss those issues in more depth where it's appropriate. So there's really robust procedures in place for us to monitor the quality of care that's being provided to citizens in the Vale. Okay, so just going on to the key issues for consideration. Well, I've already talked about it. The cost of living crisis has had a real impact on the care industry this year. Gaynor's team undertook a really key piece of work with providers this year, which really looked in depth at what those additional costs were for the industry. And that led to us as a council, and incredibly thankful for the support, being able to provide a 12% increase for care home providers, but also a 20% uplift for domiciliary care providers. I don't think I can downplay the impact that had. Without those numbers are huge, aren't they, when you talk about those as percentages? But without those being provided, some of those providers would have been incredibly difficult places. If I just take you to section 2.3 in the report, and that looks at bed occupancy for care homes, and you will be able to see that I guess we're returning to a little bit more normal in terms of the capacity significantly increased during the COVID period. You'll notice now from the graph that's shown that there is capacity within the system. However, it is reducing. We're still at a point at the moment whereby we're able to offer residential care placements to those who require it, but it's going to be a key feature really in terms of commissioning services in the future, to look at whether we've got the right beds, the right number, but also for the right people. And I think we talked a little bit about that earlier on. Just in terms of figures for today, currently there's one person who's waiting to go into a residential care home, but that's not because there isn't a bed available. They're just waiting for a start date, so they'll be able to be discharged from hospital into that home relatively soon. I think, from talking to Gaynor and Lance, the biggest challenge for last year has been in relation to domiciliary care. And I just take members to the graph at 2.5, which is, I hope, it's a reflection of just how challenging the situation that we were in last year. In terms of packages of care, you will see that in October 22, the figures peaked 124 people waiting for packages of care to be delivered. You'll see from the graph that the figures have steadily decreased, and as of Friday, the figure was 23, and that's been down to an incredibly amount of focus work, both at a regional but primarily a local level, to bring those figures down. We were at times during the year having to use VCRS, the Vale Community Resource Service, so that's our specialist team who work with in terms of enablement, and it reduced the impact that they were able to have in terms of the work that they're primarily commissioned for. So the fact that we've been able to reduce the numbers of packages of care waiting to be placed whilst drawing back from using VCRS is a real positive, but it's an area we're going to have to continue to focus on. Point 1.6 is around care in the Western Vale, and that's an area which has poses some geographical difficulties. Sometimes it's not an area where it's relatively easy to get providers to deliver care. Again, Gainer's team has undertaken a huge amount of focus work to try and resolve that, and the positive news is that we have moved on, and at this point in time, nearly all the packages of care in the Western Vale are now in place. We continue to work with providers to move away from the traditional model. We recognise that we need to continue to be innovative as commissioners. You'll be aware of the Your Choice scheme, which really supports in terms of the individual, but also agencies having much more autonomy and flexibility in terms of that package of care. We've now got a Your Choice officer, which is a new role for us as a directorate, and they're really going to lead and drive the adoption of that model. We want to really accelerate the uptake of Your Choice within the Vale. I just wanted to highlight, and it was something I talked about earlier, was about the close relationship and the positive relationship we got with providers, and the achievement that's set out in 2.8. The fact that the local authority was awarded the best local authority supporting care homes at the Wales Care Awards. So a real success, and one that hopefully reflects the positive working relationships that have been established on the ground. Internally, there's been a real recognition in terms of additional demands in terms of commissioning and finance. We've now got two separate team managers roles. So we've got a team manager for commission and a team management for finance. And there were some roles that had to be created on a temporary basis during the pandemic, but they are now permanent members of a structure, and that's going to be required because, as I say, there's going to continue to be a growing demand in terms of commissioning services. Point 3.4, and I think we've talked about it already, but the important role about the regional work, the important relationships that we've got with the health board, with our colleagues in Cardiff, Lance chairs the regional commissioning board. It's a crucial interface. It's one that's really well established. This committee would have been cited on the market stability report that Kath referenced earlier in her presentation. We're currently completing a local area delivery plan, which is going to build on that report that was completed. I've just taken members to section 5.2 of the report, and it's only just to underline the fact that it's been a significant year for us in terms of spend. Without the increased uplift, it would have been really difficult for some of those providers, and the fact that we've been supported in relation to that is really positive. So in summary, I think it's been a really challenging year in relation to commission services. I think some of the data we're presenting you today is actually comparatively good, but that doesn't take away from the challenges that the service faced during the year, and all of the hard work that was undertaken at a regional and a local level. So I just wanted to assure members that it remains one of the highest priorities for us as directorate, and we'll continue to work at pace during the next year. So thank you for taking the time to listen, and we'll take any questions.
Thank you very much. And obviously you have covered all the areas that as councillors we constantly get questions about, and I think you're aware of the challenges. and I'm sure there would be questions. Has anybody got any questions they'd like to put forward? Councillor Neil Thomas.
You know I will. First of all, thank you for the report. Many congratulations on the award. It's great to see the Vale being recognised as in this way, and well done to all the officers and staff who worked so hard to achieve that. Yes, it is difficult to recruit. Care for our most vulnerable people within the Vale. And it's not so much questions as observations. Care for our most vulnerable people in the Vale is the highest priority for all of us. I would hope, both politically and in terms of officers and staff, and which is why the increase, the uplift in the budget had to happen. We are, as I've said before on other things, we are fishing in a very small pool for the care staff that we need, especially in social care, domiciliary care, and we need to continue to support and promote the Vale as a great place to work, and work with our partners to improve that. So like I say, it's just observations. Thank you for the report and well done, and I move the recommendations. Thank you.
Thank you. Does anybody else have anything they'd like to say? No? Yeah, an excellent report. Thank you very, very much. I'm sure we all appreciate the hard work that the Vale Council in Lance's department do put in. We should be proud of the work that you do, and we are. And as I say, please let all your staff know that we are absolutely thrilled and pleased with them for all their efforts and the challenges that they are facing and getting to grips with. And that brings me to agenda item 9, which is, you'll be pleased to know, any items which the chair has decided are urgent, and you will be doubly pleased that I have none. So please go out in the sunshine, have a nice ice cold drink and enjoy the rest of the evening. And thank you very much for giving up your evenings to come this evening. Thank you.
Thank you, Chair. Thank you, everybody.
Can I just
Good night.
clarify that you're happy to second the agenda
Yes.
item 8? Thank
Yes,
you.
Amy. Yeah.
Bye all. Thank you.
Night.
Good night, everyone.
Thank you.
Night.
Bye-bye.